Dear students, in this video, we are going to see in detail about ABO blood group. This is the learning objective of my presentation. Introduction, History, Landsteiner's Law, Types, ABO blood group, RH blood group, and blood transfusion. Before going to see in detail, a brief introduction about ABO blood group. Blood group is also known as a blood type. Blood group is determined by the presence of inherited antigenic substances on the surface of red blood corpuscles. The antigenic substances may be a protein, carbohydrate, lipid, glycoprotein, or glycolipid based on the blood group. ABO blood group and RH blood group are the two different blood groups mostly present among the human population. Let us see the history of ABO blood group. Karl Landsteiner was first discovered ABO blood group in the year 1901. Adriana Starley and Alfred van Decastedo, who were working under Karl Landsteiner, discovered type AB a year later, that is in the year 1902. Karl Landsteiner was awarded the 1930 Nobel Prize in Physiology or Medicine for his work. Jansky was credited with the first classification of blood into four different types, that is A, B, AB, and O. Reuben Attenbach was successfully transfused blood between two persons at Mount Sinai Hospital in New York. He was the first person to record pre-transfusion testing for compatibility in a clinical setting. Later in 1954, he was awarded with the Karl Landsteiner Award. Let us see the Landsteiner law. If certain agglutinogen, that is antigen, is present on the surface of red blood corpuscles, the corresponding agglutinin, that is antibody, must be absent in the plasma. If certain agglutinogens, that is antigen, is absent on the surface of the red blood corpuscles, then corresponding agglutinin, that is antibody, must be present in the plasma. Based on the presence or absence of antigen and antibody in the red blood corpuscles and plasma, the blood group is classified into A, B, AB, and O. Let us see the basics of ABO blood group. The ABO blood group system is the most important blood group system in human blood transfusion. Blood having antigen A belongs to A group. This blood has B antibody in the plasma. Blood with antigen B and A antibody belongs to B group. If both the antigens, that is A and B, are present, blood group is called as AB group and serum of this group does not contain any antibody. If both the antigens are absent, the blood group is called O group and both antibody A and B are present in the serum. Let us see the RH blood group. The RH blood group system is most important after ABO blood group. About two-thirds of the human population contains an antigen on the surface of their red blood corpuscles known as RH factor, RH antigen, or antigen D. This antigen decides whether the blood is positive or negative. In the year 1940, Landsteiner and Wiener first discovered RH blood group in rhesus macaque and hence the name RH factor. Based on the presence of RH factor, the human beings are classified into two groups. One group is known as RH positive and another group is known as RH negative. During blood transfusion, the compatibility between the donor and the individual is crucial in this case as well. Let us see the principles of blood grouping. Blood grouping is done on the basis of agglutination. Agglutination means the collection of separate particles like red blood corpuscles into clumps and masses. Agglutination occurs if an antigen is mixed with its corresponding antibody, which is called isoagglutinin. That is, it occurs when A antigen is mixed with anti-A or when B antigen is mixed with anti-B. Let us see the blood transfusion. During blood transfusion, compatible blood must be used. One who donates the blood is called donor and one who receives the blood is called recipient. While transfusing blood, the antigen of the donor and the antibody of the recipient must be considered. The antibody of the donor and the antigen of the recipient mostly ignored. A person of blood group A can receive blood either from group A or group B, as there are no antibodies for A and O in blood group A. Red blood corpuscles of O group has no antigen and so agglutination does not occur with any other group of blood. So, O blood group can be given to any blood group persons and the people with this blood group are called universal donor. Whereas the people with AB blood group are called universal recipients. Why? Because the plasma of AB group blood has no antibody. This does not cause agglutination of red blood corpuscles from any other group of blood. People with AB group can receive blood from any blood group persons. In mismatched transfusion, the transfusion reaction occurs between donor's red blood corpuscles and recipient's plasma. So, if the donor's plasma contains agglutinins against recipient's red blood corpuscles, agglutination does not occur because these antibodies are diluted in the recipient's blood. Thank you.